from RPIIT campus is here to discuss about medical abbreviation which is written on the prescription. So dear students, whenever you go to a doctor, then the doctor advises and prescribes you some of the medication and which is written on the prescription. There are some of the abbreviations, and being a medical student, you must know all the abbreviations so that you can take your medication and can suggest your other family members to take it on the proper time and in the proper dosage form. So let's discuss about medical abbreviation in today's video. So the first is RX. RX means treatment. It is written on the top of the prescription, which means the treatment which is being advised by the doctor to the patient. The next is HX, which means history. If a person is having any ailment, any kind of BP, sugar or any disease which occurred before this, it is all mentioned in the history of the patient. The history is very important to diagnose the disease properly. Next is DX, means diagnosis. Whatever has been diagnosed by the doctor as per your symptoms is diagnosis and it is being mentioned by DX. Next is QD. It is about the dose or medication which is to be taken. QD means every day and QH means every hour in a day you have to take the medicine. Next is AC. It means before means some of the antacids or some of the medicines like rabeprazole, omeprazole, which are proton pump inhibitors. These are taken before the meal. So it is AC, and PC means after meals. The next is OD, means once in a day. The drug should be consumed once in a day. BID means it should be consumed twice in a day, and TID means it should be consumed twice in a day. The next is SOS. SOS means if needed or as per the requirement. Like paracetamol, when the fever is high, you take the paracetamol. When the fever gets low, then you are not supposed to take that medicine. So it is as per your requirement. So it is mentioned with abbreviation SOS. The next is IV. IM. These terms are for the injectables. When the injectables are taken intravenously, then it is mentioned with IV, and when it is given muscular way, then it has been mentioned as IM. Dear students, these two things, they are very important, and these two terms are being mentioned on the liquid dosage forms like syrups, mixtures, in cough syrups, and so the people get confused between the amount which is to be taken. So here I am discussing about 1 teaspoon and 1 tablespoon. 1 teaspoon is 5 ml and 1 tablespoon is 15 ml. So I hope you will understand and will not get confused between 1 teaspoon and tablespoon, because a little high dose may result in fatal and in side effects. So dear viewers, I hope this video would be helpful for you, and from today onwards you will not skip your right dose at the right time. I hope you have learned from this video, and very next day I will post my new video. Thank you and have a great day.